Welcome to Silicon Valley Nonprofits, a service of KMVT Community Media. I'm Bev Lenahan, your host. Today our guest is Michelle Liu, CEO of the Health Trust. Thank you for coming today, Michelle.
Thanks, Bev.
Nice
Great
to
be
have you here. Well, I know you've been working hard on the plans for the future for the Health Trust, and I understand you're going to focus on three major areas of what you're doing as it relates to your mission. So why don't you tell our viewers a little bit about that mission and these three major areas?
Happy to, Bev. So the Health Trust is a nonprofit operating foundation based in San Jose. We were founded in 1996 with a mission of building health equity in Silicon Valley. We want to make sure that everyone in our community has the opportunity to be as healthy as possible. You mentioned that we have three new focus areas.
Yes.
We are focusing on improving health through food, making key chronic conditions more preventable and manageable, and also prioritizing health in housing. And we're doing that work using three roles that we play. We're a funder, we're a provider, and we're an advocate.
So each one of those areas, you pay off all three of those, don't you?
Exactly.
Well, what would be an example, talking about food, of the funding that you do?
As a funder, we provide grants to community organizations and community initiatives that align with that mission of health equity. One really exciting example is a grant we made last year to our local food bank, Second Harvest Food Bank.
Oh, very good.
And with 2 years of funding from the Health Trust, they are expanding the number of affordable and supportive housing sites where they provide residents access to healthy food. And then they're also investing in their own internal capacity to work more efficiently with housing providers by implementing a comprehensive food security screening process and developing a suite of different services that they can offer to different sites.
So it really makes it all, the whole system more efficient, doesn't it?
Exactly. So our goal is to both help the most vulnerable in our community with direct services such as food, but also to invest in our community partners like the food bank so that they can have greater impact long after our grant period ends.
That's what we would all like. That makes it work for everybody, that's
Exactly.
for sure. Well, how about direct services? How do you deliver direct services for this health equity through food?
Yeah, so our second role in the community is as a provider. We are a direct service provider, providing an array of different services, again, to the most vulnerable in our community. So we run a program called the Food Basket, where people can come and shop for healthy fresh produce, proteins, and other necessary grocery items, so that we make sure that they don't have to worry about their food as they're working on improving their health.
So is that located right on your premise, your office premise?
So the Health Trust has multiple sites in Silicon Valley, and we operate the Food Basket in San Jose, but we also deliver food and healthy meals to people who might not be able to access that site.
Oh goodness, that's a big effort.
I think last year we provided 89,000 meals through our Meals on Wheels program.
Seriously?
To reach people in need.
Oh, that's fabulous. Oh, something to be very proud of for sure. And then we turn to advocacy, and that's another role you play, and I'm sure in the food area you do that too.
Yes, so our third role at the Health Trust is to be an advocate. We want to see systems and policy changes that improve the health for all of us in the community. And so around food, we're really excited to be collaborating with the City of San Jose to convene an older adult food access task force, where we can look at innovative models for making sure that seniors who are hungry in our community get the healthy food they need to stay healthy and well.
And sometimes it's just identifying who they are and where they are, right?
That can be one of the biggest challenges.
Yes, I would think so. My goodness, but really, really so important. I don't think any of us would want to know that our next door neighbor had issues and nobody noticed. That wouldn't be good.
Absolutely. We can't do this work alone at the Health Trust. We must work in collaboration with our elected officials, policymakers, and our other community partners to make sure that people in need get connected to the services that will help them most.
Now, how did you figure out what health equity is?
We've had a lot of internal discussions among our board, staff, and volunteers. We've also had many conversations with our external partners. But we have landed on really wanting to make sure that everyone can take a healthy bite of that apple. Some people may need more supports, some people may need less, but we believe that everyone, regardless of their immigration status, their race, their gender, ethnicity, everyone should be able to take a healthy bite of that apple.
Oh, I love that. It's very, very visual. Very nice. Well, today, more than ever, foundations, other nonprofits are asking to be held accountable for the services they deliver, the money they raise, all of that. So how are you working accountability into your structure today?
That's a great question, Bev. Accountability is essential. In addition to our own internal assessments of how we're doing, we really value external third-party evaluations and audits. Recently, we commissioned a third-party study to look at the client satisfaction in our HIV/AIDS program.
Oh, very good.
We just got preliminary findings back. We're really pleased that our clients are reporting overwhelming satisfaction with their case management services. And it's also helpful to get feedback on where we can improve, because we can always do a better job. And so getting that feedback from a trusted third party is very valuable to us.
It is, and it helps your reporting. And then, of course, we need to track this long-term impact. Are we really moving the needle on these things? And I think with the reporting, you can begin to do that. You can begin to see some trends and make it important information for our community.
We want to make sure we're providing the highest quality services that we can, and so we need the data and the ongoing feedback in order to make sure that we are consistently providing great service.
Well, before we leave, tell us a short story of a direct service that you delivered that comes to mind that made you feel really good.
I was just reading about one of our clients. She's a older woman who lives independently, and before she got connected to the Health Trust, she was eating at most one meal a day. She was suffering from multiple chronic conditions, and she was lonely. She didn't get to see a lot of visitors, and she was primarily homebound. We got her connected to our Meals on Wheels program, where somebody delivers a hot meal to her door every day. In that interaction, there's also a wellness check to make sure everything's going okay for her. And if
just
it's not,
a little bit of socialization.
Exactly. It makes a world of difference. And if she's not feeling well, that driver can make a call instantly to one of our case managers, and we can make sure she gets the appropriate support she needs. So I'm happy to report she's doing really well.
Good.
She's eating more than one meal a day now, and she really talks about how much she looks forward to that friendly visit from her driver.
Oh, very good. And I'm sure the driver gets satisfaction too out of knowing that that driver's making a difference too.
Yes, it's rewarding for everybody involved.
I love these win-win stories. That's
Me too.
Wonderful. So how can the viewers out there support you with volunteerism and also, of course, financial support?
We encourage everyone to check us out on the website, www.healthtrust.org. As you mentioned, we're always looking for program participants, supporters, volunteers, staff as well. So we encourage people to check out that website.
Very good. Well, thank you so much, Michelle, for being here. All good fortune on your new effort. You've taken on a big challenge, but I know you're up to it.
Thank you, Bev.
Thank you so much.